I wanted to talk to you guys today about walking for fitness and whether you're starting a walking program or wondering how to progress safely. The first thing that you want to do, especially if you've never started a walking program before, is determine how much you can walk to start out. When you're going to the grocery store, for instance, or if you're out running errands, how long can you walk before you really start to feel fatigued and tired? If you're having any discomfort with any of those activities, you obviously don't want to walk any more than that when you're first starting out. Can it be 10 minutes where you're comfortable, 20 minutes? That's where you want to start, wherever your comfort level is. And in terms of progression, you don't want to go any more than 10% per week. What this does is that allows all of your joints and the surrounding muscles and your body overall to really acclimate to the increased time that you spend walking, but also the increased stress on your joints that additional time spent walking creates. In terms of progressing safely, you do want to make sure that you're starting off on more of a flat, even surface until you get more comfortable walking on uneven ground, grassy surfaces, all different types of surfaces if you are walking outside. My big thing in terms of safety when you're walking is to wear light-colored, visible clothing. They also make reflective gear if you're walking really early in the morning before the sun is up, or later in the evening when the sun might be setting. Bring a flashlight or a headlamp with you. That helps not only you be able to see better so you can see where you're going, so you're not going to trip and fall over something, but it also helps you stay visible to other people. So if you're walking down the sidewalk, if there are other pedestrians walking, if there are cyclists on their bikes, or even motorists on the roadway, that helps you stay visible to them so they know where you are. You want to make sure that you're wearing sneakers that do have support. If you can take your shoe and kind of bend it and twist it up, it doesn't have the support that you need. You want to make sure that your foot is stable and that you do have the correct support to be able to support your joints. Your feet take a big beating. They support your whole body weight, so you want to keep them happy. One thing that I do recommend, if you are like me and you have super high arches, or if you have really, really flat feet, is to use arch supports. Some shoes now have built-in arch supports, but if you do feel like you need a little bit extra, you can get just over-the-counter. What this does is it helps reduce that compensation pattern. If you have really high arches, you might have a tendency to overpronate, which is also called fallen arches, and that means that the inside of your foot is going to kind of collapse inward. Another compensatory pattern that we see very often is the opposite of that, which is supination, where you're putting too much weight on the outside of your foot. And using corrective supportive shoes will help reduce those compensatory patterns. Making sure that your feet have proper support will also reduce the chances of getting something called plantar fasciitis, which is inflammation along the connective tissue along the bottom of your foot. The name of the connective tissue is called plantar fascia, and fascia is just the name for the connective tissue, and it starts at the heel bone and then it spreads up your foot through your toes. And when that gets inflamed, it can be very, very painful, especially those first couple of steps that you take. When we sleep at night, we have a tendency to let our feet fall into this what's called plantar flex position, where our feet are just naturally pointed down. But what happens along the bottom of the foot while we're sleeping is all of that tight connective tissue tightens up even more. So when we go to get up in the morning and take those first couple steps, it stretches everything out that's really, really tight and can be really painful. So using those supportive shoes and supportive extra arch supports will help reduce the chances of developing that. Some warning signs that you want to look out for when you are either starting a walking program or progressing through your current walking program is how your body is feeling and how your body's responding. If you're having any kind of pain, it doesn't matter if it's foot pain, ankle pain, going all the way up the chain, your knees, your hips, your back, even your upper back and your neck, if you don't have good posture, if you're wearing a backpack, anything that can affect you while you're walking. If you are experiencing pain, don't push through that. Call our office today. We can get you set up for a full evaluation with one of our therapists. We'll take a look at where your pain is, do some special tests and determine the cause of your pain, and then we'll put together a plan of care, plan of action to really help you relieve your pain. We'll do targeted strengthening with you to really hone in on those areas of weakness and any areas that are really tight, we'll do some hands-on manual therapy to help loosen up that tightness, make sure everything is moving optimally the way that it should, and then show you some stretches too. So we'll put together a comprehensive plan of care and get you back on your walking path. Some other risks that you want to look for: if you have a tendency to feel like you're off balance, balance plays a big role in a walking program. If you have a tendency to feel off balance, that can put you at a big risk for tripping and falling. If you do have a tendency to feel off balance, or you have a history of falls, our therapists are specifically trained in gait and balance and can help you with that. That puts you at a big risk for not just tripping and falling, but also if you do have a trip or a fall, you can sprain an ankle, you can break a bone, you can have some other serious injuries that we don't want to see. If you are experiencing any pain or soreness, you are at risk for a greater injury down the line if you don't get it addressed when you first start feeling those symptoms. It can kind of snowball over time and lead to more serious injuries, more chronic injuries. So we would like to help you prevent that. So if you are having any soreness after you're walking, there might be some specific muscles that are tightening up on you, and we can put together a specific targeted strengthening and stretching program to help you balance out those muscle imbalances.